Hi, welcome back to my channel. In this video, I'll be covering the drug of choices for most of the cancers, and then I'll also talk about the agents that are used to prevent the toxicity and so on. So starting from the first one, so we have ALL. So for this, you have to remember the mnemonic as VAPID. Okay, this is going to help you. So this is vincristine, then A, asparaginase, then P is prednisolone, I is intrathecal methotrexate, and by D you have donorubicin. Okay, then AML. Now in AML you have to remember two things only, CD. So you have cytarabine and you have by D you have donorubicin. Now this VAPID one is for induction, as I told you before, so in the previous video. Now for the consolidation, you have something which is hyper CVAD. Now what is CVAD? It's easy. This is cyclophosphamide, then you have vincristine, then you have adriamycin, and then you have by D dexamethasone. Okay, right. Now they ask this a lot of times, that is CML, so imatinib. Okay, then CLL. In CLL you have to like there's this age thing, so if it is less than 70 you give FCR. Now what is FCR? It is fludarabine, cyclophosphamide, and reducizumab. But if it is more than 70, then we give chlorambucil. In hairy cell leukemia, we give cladribine. Hodgkin's disease, ABBD. ABBD is adriamycin plus bleomycin. If you forget whether blastin or vincristine, so remember bleomycin, so blastin. And then by D we have the carbazine. Okay, then coming on to the NHL. In NHL non-Hodgkin you have something which is CHOP R. So in CHOP R, first you have the cyclophosphamide, then you have hydroxydonorubicin, then you have Omcovin, which is another name of vincristine, then you have prednisolone, and we have reducizumab. Okay, then in multiple myeloma we have bortezomib. So bortezomib, dexamethasone, and there's a drug which is lenalidomide. In Waldenström's macroglobulinemia you have plasmapheresis plus you have bortezomib. Now in polycythemia vera, this is also like most commonly asked. So in this you have to remember hydroxyurea, which is also the drug of choice for sickle cell anemia. Then in non-small cell lung cancer, you have to remember, now all the drugs, all the cancers that will come will mostly have cisplatin in them. So non-small lung cancer, you have cisplatin and bevacizumab, and you have a vinca alkaloid. Okay, then in small lung cancer, again you have cisplatin and you have etoposide. Now etoposide is topoisomerase 2 inhibitor. In mesothelioma, this you need to remember, you have cisplatin plus you have pemetrexed. Then this is going to be asked most probably, so this is cisplatin plus 5-fluorouracil. Okay, then esophageal cancer, again same. Then uterine cancer. In uterine cancer you will have some of the progestins or tamoxifen plus you will have CD. Okay, then in ovarian cancer you will have the paclitaxel. Similar in cervical cancer with cisplatin. Now in breast cancer they have done something as pre-menopause, post-menopause. So if pre, then you give tamoxifen, and if post, then you give aromatase inhibitors. Alright, then in this choriocarcinoma also they ask, so this is methotrexate. In testicular cancer, BEP. Now what is BEP? It is bleomycin plus etoposide plus platinum compound, that is cisplatin. Okay, then this also is asked, so in this test we have sunitinib. Okay, then in bladder cancer you have to remember gemcitabine. Prostate, basically you will give androgen inhibitors. Then astrocytoma. Now here you have to remember temozolomide. Now this is also a question that this is an oral drug, right? Then neuroblastoma. In neuroblastoma, basically you have C, D, C, E. Okay, so you have cyclophosphamide, then doxorubicin or doxorubicin, then cisplatin, and then etoposide. Then thyroid carcinoma. This you can remember I-131 or sorafenib. Now in this, there's this one point recent, that is the vandatinib is used for medullary carcinoma. Now it is also covered in general surgery, so this is an important point from exam point of view. Then stomach cancer, again you have cisplatin and 5-fluorouracil. Then in pancreatic cancer, gemcitabine. Colon cancer, we have something as FOLFOX6 plus minus bevacizumab, or you can have FOLFOXI. Now FOL is folinic acid, FOX is 5-fluorouracil. Now when it is OX, so by OX it is oxyplatin, and if it is I, it is irinotecan. Okay. Then in rectal we have 5-fluorouracil, anal cancer also 5-fluorouracil. Then over here this is asked, so insulinoma you have to remember I for insulinoma, interferon, or you can give streptozocin. In osteosarcoma you have to remember basically code, so you have C, D, so obviously that is cisplatin and doxorubicin. Now in GIST, that is gastrointestinal stromal tumors, we have something as imatinib or sunitinib. Alright, then coming on to the soft tissue tumor, in this you have something called as MAID. Now what is MAID? Now MAID is basically mesna plus adriamycin plus ifosfamide and dacarbazine. Alright, so after this we have HCC. Now in HCC, when I covered the anti-cancer drugs, so I told the drug was sorafenib, which is also used in renal cancer. In melanoma, now it depends if it is associated with the BRAF mutation, so obviously you will need some OMAB, so we will use nivolumab, and if it is not associated, then dabrafenib. Now this Kaposi sarcoma is liposomal doxorubicin. Now these ones are a little different. So in carcinoid, by O just remember octreotide, and by adrenal you have to remember mitotate. Okay, now we'll just go through some toxicity and basically the reversal agents. So if you have hyperuricemia due to tumor lysis syndrome, we will use allopurinol. Okay, and if you have hemorrhagic cystitis, then we will use mesna plus we will use hydration. If you have high dose given of methotrexate, then you will use folinic acid or basically leucovorin. If there is cisplatin induced nephrotoxicity, then we give a radioprotector, that is amifostin. If there is a cardiotoxicity due to anthracyclines, then this you have to remember, this is a little different, so you give dextrazoxane. Then if you have to prevent the bone marrow suppression, so in the bone marrow suppression, this is also a little different, so you give trilacicillin. And if you have irinotecan induced, so you give loperamide. And for cisplatin induced nausea vomiting, you give briptant. And if there is vesiculation, so we give thiosulfate. So this completes all the objective points that you need to know, and even if you have to just simmer it down to some points that you just need to remember, so I'll just tell you the ones that are really important. So these are the ones that are mostly asked, so you can remember these. And these are all you should know. Okay, so if you found this video helpful, do give it a like, share, subscribe. Thanks for watching.